So good afternoon, everyone. I think we'll make a start. I think there are people still joining, but I'll just say a few introductory words. By the time we get to the real, I suppose, main items on the agenda, hopefully people who are still joining will be there. So good afternoon. I'm delighted to welcome you all to this webinar on public health measures in place in early learning and care and school-age childcare settings operating during COVID. My name's Toby Wolf, and I lead the Early Years Quality Unit here in the Department of Children, Equality, Disability, Integration and Youth. And before we begin, I might just note that this session is being recorded and will be made available on the First Five website in the coming days. So I'm joined by Dr. Abigail Collins, consultant in public health medicine from the HSE, and by Ms. Elaine Murphy, lead inspection and registration manager from TUSLA. As you'll be aware, expert guidance on the operation of early learning and care and school-age childcare has been provided by the HSE's Health Protection Surveillance Centre and has been updated on a number of occasions since it was first published in May of last year. And a specific public health testing pathway has also been put in place to manage cases of COVID-19 where they occur within services. And regulatory guidance for services operating during the pandemic has also been provided by TUSLA, and a revised approach to inspections during this period has been developed. And in addition to these public health and regulatory supports, the department has made a suite of other supports and resources available on the First Five website and through social media platforms. And we've also put in place supports through local city and county childcare committees, including a specific out-of-hours COVID-19 helpline. All of these resources are kept under regular review in order to ensure they're up to date and aligned with the latest public health advice. So the purpose of today's webinar is to remind and advise you all of the public health measures currently in place, to highlight the learning from cases on the ground, and to address some particular issues which you may face during the summer months and coming into the autumn. So I'm shortly going to hand you over to the first presenter, but just first a couple of housekeeping matters in advance of that. The session will be an hour in duration, so we will finish by 3 o'clock. And there should be time for quite a few questions following the presentations. So please feel free to put any questions you have into the chat box at any time. We'll address as many of them as possible in the Q&A session at the end, within the time frame of finishing by 3 o'clock. Given the short time available, we'd ask that questions are confined to public health matters. Finally, just a reminder, the session is being recorded and will be available on the First Five website in the next day or two, and so will be available for you to listen back to, and for anyone who couldn't attend today to watch at a time that suits. So we'd encourage you to share the link to the recording when it's available with colleagues and parents in order to ensure that these important messages regarding public health continue to be shared widely across the early learning and care and school-age childcare community. So I'm now going to hand you over to Dr. Collins of the HSE for our first presentation. So over to you.
Thanks very much, Toby, and thanks for hosting this event today. I will try and share my slide if I can. That's something that works. Are you able to see that? Yep. Okay, perfect. Okay, so as I said, my name is Abby Collins, and I've been involved in the public health sort of operational side, I suppose, in terms of responding to cases and outbreaks of COVID-19 and supporting the departments of public health across the country in providing those supports. And so this is really, I suppose, just to remind and refresh some of the infection prevention control measures that are important to be in place and to keep in place, and to talk you through a little bit of what we've learned from the cases that we've responded to, and I suppose how the process of us working with the has been, I think, very helpful and supportive and allowed us to sort of share lots of messages. So I'll go through a few of these slides. So just going to give a very quick overview of COVID-19 transmission and the implications for the new variants. the prevention and mitigation measures in place for childcare settings, some of the key and core important ones from our perspective, and as I said, learning from some of the cases and outbreaks that we've experienced. So I suppose, particularly there's a lot around the new variants that's in the media, in the press, and has been of sort of concern recently. And particularly the Delta variant you would have heard about. But in essence, the variants seem to spread in the same way. They're mainly droplet and contact, but they're also airborne spread is seen too. But the precautions that we've been recommending, the public health measures that we've been recommending since the start of the COVID-19 pandemic, all still work. They're still all the ones that we need to have in place for these new variants. But I suppose, the bad news is there is less wiggle room for implementation, unfortunately, because each new variant, to become a new variant, the virus has to be smarter, it has to be a bit better at propagating, it has to be a bit better at doing everything that it does, which means that we have to be a bit better at doing everything that we need to do to prevent its spread, unfortunately. So in terms of the risk of transmission, well, as I said, it's mainly from close contact with someone shedding the virus, who is coughing, sneezing, or speaking, and the droplets that come from the mouth and the nose predominantly. Also touching surfaces, if someone is touching a surface and they've got virus on their hands, and then you go and touch that without it being cleaned in the interim, that's another way that can spread, and particularly if you then touch your face from your hands without having cleaned them. So hence the importance of regular hand washing or use of alcohol gel. And we also know the importance of ventilation, and hence the importance of being outdoors as much as possible, or making sure that rooms as best possible have windows and doors that are open or open at certain points of the day to get a through draft and make sure that there is a reasonable ventilation in the premises that we work. So in terms of, some of the symptoms and the period of transmission and infectiousness, the time between catching the virus and getting symptoms is usually about 4 to 7 days, but it can be up to 14 days, and it can obviously happen before 4 days. So it's, up to 2 weeks, but its average is 4 to 7 days. So people are most likely to spread the virus in the early stages when they're symptomatic, but we know that people can spread the infection from a day or two before their symptoms develop. We also know that some people have very mild symptoms or no symptoms that they discern at all. We know that severe illness is more common in older people and people with chronic long-term conditions rather than in children or adults who are in good health. And the common symptoms include the high temperature, cough, shortness of breath, and loss of taste and smell. And there's no current change to this with the different variants seen, but I know internationally and globally this is being kept under review as to whether the symptom profile should be changed at all. But at the moment it remains as it is. So in terms of children, we know that children are generally more likely to have mild disease, that they're not the drivers of infection of COVID-19. They're less likely to spread it to than adults or other older children. But of course, less likely doesn't mean impossible. Children do get infected, and a small number can get severe disease, and infection can spread from children to others, including adults and other young children. So when we're notified of a confirmed case, I suppose one of the things that it is important to remember is that individual is already out of the school environment, the childcare setting, or whatever the environment is. That person, that child or adult is already out of that setting, or they most definitely should be out of that setting and should have been since they had concerns about COVID-19 and went for their testing. And that's really one of the most important things to make sure is implemented and enforced. And one of the important things to make sure is to feel reassured about that they are out of that setting, and it allows us the time to do the public health risk assessments. So in terms of the public health approach, well, we're generally about prevention. We rather people didn't get sick and there were no cases in the first place. But that said, we then look to give advice on protection and mitigation measures to make sure that if there are cases, which there will be of most infectious diseases, that the onward spread is limited as much as possible by the routines that we have in place. And then obviously there are cases and outbreaks in settings, and that's where we really come into the assessments and onward testing. So as far as practical from the prevention point of view, really, it's to make sure that no cases, no one with symptoms which could be consistent with COVID-19 or close contacts of COVID-19 attend any facilities, be they staff or children. And then I suppose the next best thing is to make sure that your protection and mitigation measures are in place. So this is the hand hygiene, the physical distancing, the respiratory etiquette, the face coverings, the environmental hygiene, and that close observation of each other as staff and children to make sure that you know, we're minding each other and facilitating each other to make sure that they can voice if they're feeling unwell and go home as appropriate. So in terms of prevention, you know, we're lucky now that we have a vaccine and we have several effective vaccines that are available. And all vaccines being offered through the HSE are safe and effective, and they go through a lot of regulatory framework before they come to the expert group to have a look at all the information and make their recommendations, and that's NIAC here in Ireland. The NIAC make the recommendations to government. So the vaccines that are available through the HSE are all safe and effective. And I suppose, you know, this is one of the most important and core prevention measures that we have. So please do encourage all staff to get vaccinated and facilitate their attendance for vaccination as best able to within the settings. You know, that's really one of the most important things we can do to make sure that we limit the onward spread of COVID-19 within the country. So the next thing, as I said, is making sure we take all practical measures to ensure people with COVID-19 symptoms don't attend the childcare setting. And unfortunately, this is something that we commonly see when cases are notified to us and we have outbreak settings, that someone was there 2, 3, 4 days where they were unwell and they had symptoms and ideally should have stayed at home and sought advice from their GP. So it's really important to keep promoting that awareness to staff and families on symptoms with some of the posters and messages that have been developed and are available. And advise staff not to attend work and self-isolate if they're unwell or if they've been identified as a contact of a case of COVID-19. This is really important to make sure those who are at high risk are kept out of the environment until it's clear that they're not at risk either from their symptoms because they've had a test or they've done their restricted period from being a close contact. So advise parents not to send their children if they or other household members have suspected or confirmed COVID-19. And we do see that where people have dropped children off to childcare and they've gone on to have their COVID test themselves. So it's about reinforcing those messages that if anyone has symptoms and is required to have a COVID-19 test, then everyone else in the family should stay at home until that result is known. And it's about promoting good hygiene for all and respiratory etiquette with posters and reminders in the facility. And you know, that's good in terms of the facility, but it's also good in terms of those general reminders for us all in our everyday living, which is what it's all about across the whole of society. So easy access to the alcohol gel and hand washing stations is really important, really valuable. In terms of the prevention and mitigation measures, moving on, then it's really about limiting the mixing of groups of people. So if you can try and keep it out, that's the best thing to do. So have your vaccination, don't attend if you're symptomatic or a close contact. Then the next best thing is to really make sure that if someone is there, not only do you have all the things in place to stop and make it much less likely that they'll transmit, but also if they do transmit, to make sure that it's the tightest, smallest group of people that they could do. So that's the whole idea of the pods, really, which have been much talked about, and it's to limit the mixing of groups of different people. And that not only has the impact that it means that less people get designated as close contacts, but it has the most important impact of making it less likely that more people get COVID-19 infection. And that's the thing, you know, we want to avoid spreading those infections. And there are various different ways of thinking about how to do that. The obvious one is within the contents of the day work and the pod and the structures of those systems. But there are points where we see that some of those things become more challenging. And that's the sort of before hours, the after hours, the drop off, the pick up arrangements. And it's trying to think of how that can be done as best possible to limit again those prolonged mixing of groups of people. Having the signage, the pedestrian flow, and the drop-off points, having that sort of systematically organized to facilitate and remind constantly people of the importance of these things. The use of point of contact and sharing of common facilities between people and sharing of toys between the pods, etc. And this all still needs to be considered now, unfortunately, as I said, even more so where the circulating variants are becoming, more infectious, I suppose, with increased transmissibility with each variant, and that will be the way forward. And it's really important, particularly with the summer camps that might be there, where there might be a broader mix of children over the next few weeks. And of course, people sort of more relaxed in the sort of summer holiday mode, but those elements still need to be very much in place. So children and adults should really try and remain in the same pod as much as possible and as much as they can. And different pods being really as distinct as they can be, and not sharing toys and having separate breaks, meal times, etc. It's really important, and we really experience that with the facilities that we go into. Some the sort of structure and the mapping of the facility makes that more challenging, and others are more able to implement it. But it does have, the tighter it is, the tighter, I suppose, the impact of any case is on the facility. So it does stand if and when a case is notified to us. We've had big issues with floating and relief staff members who've moved from pod to pod, especially if they're the index cases, but even if they're not and they transpire to be positive from a close contact, if they've gone from pod to pod, or sometimes from one premise to another premise, if it's more than one premise as part of the facility, we have seen you can map that infection spread, unfortunately. So it's really important to make sure that as much as possible, people don't move, and if they do, and there's obviously a very practical need sometimes to have relief staff members and floating members, that is really considered, how that can be as tight and compact as possible, that it's limited to certain rooms that they do, that it's organized who is covering what different pubs or what different classes or what different facilities, to minimize that impact of mixing. So where practical, children from the same household, for example, should be in the same pod. I realize it's not always easy to implement with the different ages and the different structures, but it's about trying to keep together people who might live together, who have shared exposures outside of the facility, to minimize the impact within the facility. So the same applies to staff, and we often see that groups of staff living together who might then work throughout the entire facility, and therefore the impact on the entire facility, if there is a community household case within that household, can then obviously have a very significant impact on the facility. So where possible, it's thinking about how to minimize the onward spread, and we do have to therefore think about where people are coming from and the units they're within in their home setting. And obviously from our perspective, the record of where people have been and who's in each day is crucially important when we come to do our risk assessments and contact tracing. So physical distancing is obviously very important, but very challenging in the environments that that you're working with between the young children. But as much as possible between childcare staff and other children between pods, we should always look to maintain physical distancing. And an example of this is sleeping cots, and we've unfortunately seen that several times where there hasn't been distance between the cots that have been used across pods, and it's trying to keep those things tight. So either that you would have the cots close together just for that pod, or if you've got a set of cots with different pods being used, then they need to be spaced out. And it's about staggering the use of canteen or other shared rooms from the staff perspective, because break times is when we want to let our hair down and just relax a little bit. But unfortunately, that is commonly a time where we see transmission spreading, I suppose, amongst staff members. And by this, I don't mean just within childcare facilities. We see it in the healthcare sector. We've seen it in pretty much every kind of facility that we've worked in. So it's just important to try and set up a routine to minimize that, because people do want to relax slightly. And so it's making sure that that relaxation can happen as much as possible in a safe space. And managing entry and exiting to avoid close contacts in doors and hallways, etc. It's just all these little things all add up and to the benefit of minimizing onward spread. And I would say with the advancement of fantastic summer weather, and to encourage the outdoor activities as much as possible, because we know whilst there's no risk of infection outside, the risk is lower. So it's still important to keep some distance and be mindful, but it is better to be outdoors. I certainly will be weather this week, and I'm sure that will be the way of the summer. So it's just trying to maximize those opportunities for outdoors as much as possible. So face coverings is something that, you know, there has been, I suppose, an effort to sort of communicate, and there's been a slight change in the nuance of the messages over time. And that's because we've seen the value of it, and we've seen where instances where face coverings have not been used in the same way, and that there's been a higher onwards transmission of infections. So staff really should use face coverings in early learning and care settings when it's not possible to keep a 2-meter distance from other adults. And staff should wear a face covering when in close proximity to children, if doing so does not pose a barrier to early learning and care. And it's expected that use of face coverings will generally be practical when attending to school-aged children, because I suppose they're used to that within the school setting. So it's not wishing to pose a barrier to the sort of normal interactions in care, but it's just trying to be mindful that if you're, you know, if you're talking to another staff member and you're not interacting with a child, then that is when you need to be using your face covering and maintaining your distance as much as possible, and particularly using the face covering if that distance is difficult to maintain. There's obviously the recommendations in terms of the cleaning and the increased frequency in the high contact areas, and we've discussed the need for the washing the hands, and that goes for after the cleaning. So I suppose the experiences from ourselves from the public health response, as many of you will know, that if we get notified of a case who was in the facility within their infectious time period, we undertake a public health risk assessment. And that's in essence, we have a standardized forum for that, and we ask lots of questions. And we use that information obtained from the settings of the childcare facility, also knowing what we know about the case and where we think the source of the infection might be, and also what we know about our community. So all of those elements come to be very important in deciding how we determine who the close contacts are. So these close contacts, as I say, are identified through all the information from the public health risk assessment of which, you know, the information we get from facilities is one really core important part, but we do have other information sources that are very valuable to us. And you may well therefore have different numbers of contacts identified with 2 cases in different classes. And I know that can be hard to understand, but it's having the systematic approach doesn't always mean the outcome is the same. Because, for example, one child's source might very well be outside of the home setting, and they might, outside of the childcare facility setting, have a clear source within the community or family setting. And you're looking to see the impact of that case within the facility. And if they were there a short time when they were symptomatic or in their infectious stage, that might limit the concerns that you have there. Versus if you have someone that you think their only source really of getting the infection might have been within the facility, in which case you think there might be you know, more action required, and therefore you know, you're likely to have a more precautionary approach in terms of the number of close contacts that need to be identified at the first tranche. So as you know, the close contacts are excluded and asked to restrict their movements, and then we refer them for testing. And the testing is prioritized and coordinated through the school's pathway, as it seemed to get known, but it applies for all of the settings for educational purposes for children and childcare purposes for children and staff. And from that, the important thing about having that grouping together is that we get the results as an urgent group together, and it's that group of results that helps inform us whether we need to do wider exclusions or wider testing. And through the process of the public health risk assessment, we learn from you where we think there are specific measures in your facilities that could be tightened up, or, you know, odd areas that could be a weakness. They might not have proven to be a weakness in the particular instance, but it's a weakness that potentially could be improved, for example. And we learn these things all together. We have twice weekly national meetings, and we pull these experiences together, and then we use those to engage with colleagues in TUSLR and the department, etc., to get messages out to you all to help, I suppose, to help improve the resilience for all of the facilities. And I suppose an example of this, I just want to talk about some of the data, and I know we all hate numbers, but it's just to show a little bit of that impact. So in terms of, I've called term 1 really sort of the opening from when we established the school's testing pathway, which was around the end of August time, up until Christmas. And 390 facilities came to our attention for public health risk assessment and onward testing. And we tested nearly 9,000 people and had a detection rate of around 4.6%. So that was how the index came on to have COVID-19 through being identified as a close contact. Now, not all of those cases would have been through the facility themselves, and when you've got a high background rate of infection, you will naturally pick up other cases, but that's what that rate was. And then term 2 obviously started in January, and we've done that down until pretty much the time point that we're at. And we certainly saw that detection rate rise a little bit. The average is 6%, and it rose a little bit above that in sort of end of January, February time. And that was the point where we were hearing a good bit about certain, I suppose, measures, particularly with the cross-staffing. We became aware of, I suppose, young colleagues who would live together and then go to work within the same facility, but in all sorts of different rooms. And we could really see the impact of where face coverings were being worn and where they weren't. So hence the nuance in some of the updates of the infection control guidance available. And also we worked, as I said, with the department and with TUSLA to help get the messages out, and we've done webinars before, to get these messages out that we're noticing these things when we manage outbreaks, and these are what we could do to try and prevent that. And I think the latest week's data that we have, and this has been sustained, shows the success of that. The detection rate has gone right down to 2%. So, as soon as a lot of those measures were put in place and we could get that information out to people and you were able to implement that and we could support through all the different agencies and organizations, we did notice an impact on that, which is really valuable. So I suppose the final sort of points are, with mitigation measures implemented and in place, it maximally helps prevent the onward spread of infection. COVID-19 is around in Ireland, unfortunately, and it's peaked and it's waxed and it's waned and it comes back again. But really what we've seen has been fairly stable within facilities despite all of that. But that doesn't happen by chance, it happens by all of your hard work. And I said, as I say, the important things are really, prior to attending facilities, make sure people are vaccinated as much as possible and make sure people are aware of their symptoms and are excluded as a precautionary measure. The second thing is making sure the measures within the facilities are optimized as much as possible. You have to think of those. The guidance is always a little bit abstract and you have to try and apply it to your own setting. And I understand that's challenging at times. But how you can really maximize the effect of your efforts and mitigations, to make sure you're always thinking about the lowest numbers of people who might be involved were someone to be a case, and all of the things to do to stop that onward transmission. And then obviously public health come in and follow up with cases and outbreaks and give any advice which might be useful specific to your facility at that point. As Toby has alluded, there is obviously the guidance on the HPSC website, and there is a lot of information and supporting information that they also produce themselves, as do TUSLA. And I'm sure if you're aware of that guidance, but most of the relevant guidance in terms of the settings from the HSE is on the hpsc.ie website, and that's where a lot of the online resources and preparedness is. That's me. Thank you.
Thank you very much, Abby. That was very clear and helpful, and particularly, I think, to hear the learning from all the cases you've seen over the last year. So if anybody does have questions arising from what Abby said, please do put those questions in the chat box. Abby's will be available to answer questions in a few minutes, and we'll do our best to get through as many questions as we can in the time we have. So I'll now invite Elaine Murphy, Lead Inspection and Registration Manager of TUSLA, to speak. And I know she's also joined on the panel by Eileen O'Leary from TUSLA. So over to you, Elaine.
That's great. Thank you very much, Toby. And I'm delighted to get the opportunity to talk to you all today. Just to introduce myself, my name is Elaine Murphy. I'm Lead Inspection and Registration Manager for the Early Years Inspectorate. I suppose my talk this afternoon is just to recap on our inspections during COVID-19, some of our findings during the inspections, and again, the resources and supports available to you from ourselves. Just moving on now, I suppose, just to recap for everybody and a refresh. Why do we inspect early years services? It's so important. Families need quality childcare and they need assurances regarding the safety. So any failure in childcare, it's not acceptable. So the regulation raises standards and drives compliance, and obviously quality childcare is so important for our economy. In terms of the legislation around that, I know you're all very familiar with it. It's the Child and Family Act. And moving on to the next slide there, we have the regulations from 2016. So really how policymakers have legislated for the inspection of earlier services, and we act as the independent regulator for same. I suppose, again, it's important, if we move on there, Edel, to just reflect again on your legal responsibility in terms of safeguarding the health, safety and welfare of children and complying with the regulations as outlined. So just to recap today in relation to that and your job, the focus again for you all, for your services to be safe and happy places for children to play, learn and develop, and obviously to be child focused all day, every day. So in terms of our COVID-19 and inspections, we have obviously, when COVID hit last March, we definitely had to recalibrate and relook at how we did our inspections. And again, thanks to you in terms of you working with us in enabling us to continue our work throughout COVID-19. So again, we had a revised methodology in place in line with public health to ensure the safety of your staff and your children and our inspector team. I suppose coupled with that, recently again, we had a recent cyber attack which limited the amount of emails or documentation or policies that you as register providers could send in to us. So again, we have shifted slightly again and reviewing documentation on site, or it can be copied and reviewed remotely. So again, just to outline how we go about or how we prepare for an inspection, our early years inspectors, they'll look at previous inspection reports, any information available to them, look at the regulations and formulate their plan to go out and inspect on site. Step 2, really, we are unannounced inspections, and very much this on-site assessment takes place really keeping in mind everything that Abigail has gone through again in terms of that strict physical distancing, wearing appropriate PPE, and all of keeping in line with all of those public health guidelines while we are on site. A feedback meeting can take place remotely or on site if agreed by both parties. So we're conducting the inspections, and following the on-site inspection, the inspector will draft the inspection report and issue to you as per the standard protocol, and then engaging with the register provider in terms of any corrective actions or preventative actions in tandem with the factual accuracy, and then reports can be published without delay. If services are non-compliant, obviously there's an escalation process that we follow also. So again, we've been very successful throughout COVID-19 conducting inspections, and we really appreciate your cooperation with all of this, and we have worked throughout COVID. Again, just to highlight our methodology, aligned with public health guidance and the focus on health and safety, inspectors wearing, I suppose they have the specialised FFP2 masks that they are face fitted for. So again, really in terms of our own safety and risk assessment in terms of that, very key to our on-site inspections. Reduced time on site, so again, just sampling of documentation, sampling of rooms where required, and again, following our standard procedure of issuing draft reports. And then, if appropriate or if needed, we are still conducting regulatory compliant meetings and regulatory enforcement meetings. They've all been undertaken digitally as well. So very successfully continuing our regulation duties going forward. I suppose we do have an element of bespoke inspections as well that we carry out, and these would be around any areas or any services where any additional significant risks would be identified. If we have a history of persistent non-compliances or issues that weren't addressed in the CAPA or closed out, we certainly will go and inspect. We would have some feedback and concerns received, in particular for some services. Again, we act on those and carry out inspections. And overall, our inspections and our inspection plan is reviewed. It's consistently reviewed. So then I suppose moving or shifting to very much looking at the findings, and it's really positive. I just wanted to highlight some positive issues today and to feed back to you in terms of very much that consistent message of hand hygiene and respiratory etiquette, and some really lovely visual aids around the country and those cues for children of doing that in a really gentle way, which was very good to see on inspection. We hope to see the long-term benefits of this enhanced infection control. And another, as I said, echoing what Abby said about outdoor play and outdoor areas and being outdoors, we've really seen a huge maximisation of outdoor play by yourselves and very innovative solutions again in relation to doing that, and children out in inclement weather and all of that. So really good and very, very positive. So there's also been a key shift there as well, an additional focus on training of staff, and we've really seen that grow and develop as well as we go on our inspections. Abigail has covered in full there in some of the issues, but I'll just touch on them slightly going forward. Again, of issues that we found going through the inspections was obviously again the area of pods and infection control, and that mixing of staff, as Abby said there, was proving to be difficult for some areas. The hygiene measures as well, I suppose there was definitely nappy changing as well, very much to have a key focus on that in some areas. The cleaning schedules as well, I know they were proving challenging for some areas in relation to indoor and outdoor areas, but again, maintaining that cleaning schedule again going forward. Again, I suppose with mouthing toys, managing or drinking utensils in terms of managing those, having policies in place in line with infection control. So definitely as well a challenge and one you have risen to. Certainly we can really see that. Going along there, I know Abby noted that there is face coverings. Again, I just noted we noticed that there is mask wearing. Again, an increased use of that throughout our inspections, so we definitely saw that. But obviously, again, to be taken into account the individual differences and the care needs of the children that you're caring for as well. And we're very cognizant of that. Touching again on the staffing and again, how this proved a challenge as well from the different areas, the break times, staff who were maybe living together, traveling together to work or going at home as well. And I suppose an area that has been, some issues as well have arisen there. You have been innovative in using additional exits for the drop-off and collection points, but I suppose they too have brought their own challenges or their own risks in terms of utilisation of fire exits or different exits as well. So really the focus of supervision of the new exits as well, really a point I'd like to really emphasise with you today. So the key learning from the COVID-19 and the outbreaks has been the importance of wearing the mask or the face covering, really in terms of that. And we did have one particular service where, example of a student who wore the mask for the entire length of her time there, and she, when the earlier service tested positive, she was negative. So really there, I suppose, tangible evidence in relation to the face coverings and the masks working within the setting. Again, reviewing the living and working arrangements of staff, the cooperation of staff and parents in not attending with their symptomatic. This has been an ongoing issue, and I know really Herculean efforts have been made in all settings with visual aids and constantly advising parents via electronic apps, etc., in relation to not attending if they're symptomatic. And again, to keep really emphasising that message that's key. The enhanced cleaning procedures, again, really, really important and have been shown to be really everything is taken on board by the services. That we were very impressed with a lot of the cleaning schedules that we did come across. And again, those hand washing practices are maintained in relation to that physical distancing and respiratory etiquette. We really thought in talking to all the services as well, that just to do what you have to do and do it well. And really we have seen a lot of our inspections, a high level of compliance with those public health guidelines. Just moving on there, I suppose in terms of the supports to childcare providers, as was mentioned earlier there with the COVID-19 helpline, which really a point of direct contact for you, and that's still there, and the contact details are on my slides following. And again, the three key messages really, as I said before, still remain. The COVID supports, I suppose we have our own website that you can go to, that you can access in relation to update for you as early years to providers on COVID. And then on the next slide, you have the COVID-19 helpline, which is still active. And very much again, we have got a lot of calls. And I suppose we just did a brief overview of the queries received there. Again, there's similar themes coming across, as I said, what Abby had spoken about earlier in terms of the queries that are ongoing or queries there in relation to that, the equipment, the pods, and in terms of that, the sanitary facility and the distance between the pods and the sleep room, etc. So a lot of the queries received, and I hope you have found the answers useful as well, because we've had significant contact with yourselves. Then in terms of the COVID notification form, if you have a case, obviously within your service, that you are required to complete the TUSLA Early Years COVID notification form and send in to us within 48 hours of that case. Obviously, as well, in tandem with that, you're notifying your public health, and we also follow up with public health in terms if there's anything we can assist or advise, or if there's any further as well. So again, those notifications have been coming in, but just to confirm that you are required to send those in also. The conclusion, it really hasn't been an easy time. It's been challenging for everybody, both professionally and personally, and we totally appreciate that. And definitely you have risen to the challenge as a sector, really. We can see that, and it's evident throughout our inspections. The challenges again, and just to name a few, I know Abigail there, and very informative talk to us there in terms of the changing nature of COVID, and it again will change again. So we are dealing with that constant flux in relation to COVID-19, the challenges for your own family, for the families of your the children that you care for, your staff, and that pod structure and the management of all of that. But there have been some benefits, and it's important to note that too. We really have seen an enhanced focus on infection control. It's been very impressive. And then in terms of that, we have had reports as well that there really has been that increased time for that staff-child relationships to develop. And that has been really, really important as part of that process also. I suppose that's concluding, or that's coming to the end. So if there is any discussions there, or if you'd like to ask any questions, as I said, we have Eileen O'Leary here, who's the head of inspection and registration there with Early Years Inspectorate. So again, be very happy to take any questions as well also.
Thanks very much, Elaine. So we do still have about 15 minutes left, so I'm going to hand over to my colleagues from the Department of Children, Margot Dunn and Adele Cohen, who've been monitoring the questions that we received both in advance of today and during the webinar, and they're going to try to, I suppose, pull together a few key questions to pass on to our panelists this afternoon.
Thanks, Toby. Yeah, we've been getting a good few questions coming through there, in particular in relation to vaccinations, and Abby, you might be able to assist with some of these. There's a number of questions in relation to, I suppose, the impact of vaccinations on staff. So do fully vaccinated staff still need to follow close contact protocol? Do they need to wear face masks to observe social distancing? So maybe, and I know there was some recent changes to the HPSC guidance, maybe you could talk to us a little bit about that.
Thanks, Margot. Yeah, I think this is definitely an area where, you know, this is going to be in place over the next few weeks and months. So, you know, currently, if you've got fully vaccinated staff, and there are, you know, clear definitions of that depending on the type of vaccine that someone's had, when they're contacted by the contact management program, they will ask some questions around that and determine whether they therefore need to be classified as close contacts or not. So that's done through the contact management program. When someone is identified as a close contact, then they will say whether, okay, you're fully vaccinated and you have no other significant health condition, for example, or we're not investigating a variant of concern that we're particularly worried about, for example, and you have no symptoms, therefore you don't have to restrict your movements and you can work in the workplace. But there may be occasions where someone is fully vaccinated, but because of the answers to those questions, it's determined that they should still restrict their movements, for example. So if you think that someone, and it possibly wouldn't happen so much in terms of the setting that people are working in with yourselves, but it may be that someone is quite vulnerable and we wouldn't necessarily expect them to have the optimal response to a vaccine, in which case you would still want to restrict the movements of that person, for example. And there are a list of conditions for that. So, you know, in general, at the moment, if you meet the definition of fully vaccinated, and that's determined by the contact management program, it's not expected that you would self-determine that. So anyone who if someone contacts you to do the public health risk assessment, all of those people should be identified as normal, and when they have their calls, then it will be determined whether they need to be as well. In general, no, but there will be some occasions where that's not true. At the moment, in terms of the use of face coverings and and distancing, etc., all of those measures are still recommended and in place and should be implemented. It is likely to be an evolving space, but that's not fully determined yet and in the guidance. And I suppose it depends a little bit. There's been, as I say, there's been ups and downs literally in terms of peaks and troughs of incidents and a few stings in the tail and changes along the way, as everybody will knows in terms of COVID. So I wouldn't like to guess in advance what those changes will be and when they will be. They depend a little bit on sort of government policy as much as anything, in terms of, you'll see different, you know, internationally different sort of paths forward. So quite where we go, you know, is slightly dependent on government policy based on NPHET advice. So I think that will be a changing space, but at the moment, no, keep all of those measures in place.
And Abby, related to that, we had a couple of questions in advance of today's session on the rollout of the vaccination programme. I think it might be fair to say that you can't really say much more than what we already know publicly, in that, you know, the situation is at the moment, those aged 18 to 34 can register through their local chemist or a chemist on the list of those providing the vaccines, and everybody else has been dealt with in turn.
Exactly, that's exactly right. That's the process, and I certainly am not party to any further information, unfortunately, that I can give. So yeah, it's very much as it is, and as we said, you know, that's a dynamic process, and I'm sure will continue to be so too. But you know, that's very much, you just have to keep an eye on the website as to what the current recommendations are from NIAC to government and what they implement.
And certainly from the department's point of view, we would encourage all providers and their staff to get vaccinated when it becomes available to you. It does protect you and your service and the community around your service. So I think it's fair to say, once it becomes available, we would encourage you to go ahead and get vaccinated.
Yeah, I think that's really important point to reinforce. You know, all the vaccines are safe and effective, and it's really better that they're in people's arms for the individual and for the community around them. And so as much as possible, you know, facilitating to attend for vaccination appointments, I know can be challenging as well, but you know, I think it's time worth spent.
Abby, we've had a few questions there on travel. I know it's a topical issue during the summer months, and things are changing, I suppose, in the next couple of weeks with the new travel situation within Europe. Can you say anything in relation to how that impacts on ELC and SAC? Obviously, for children in younger age groups, some of the main rules don't apply. It's more to their parents and their families. So could you talk to us a little bit about that?
Yes, and you know, so this is really sort of a government directive. So it's the gov.ie will give what the travel advice is and what the restricted movements are that are required and what the testing policy is. And again, it's an evolving situation. Obviously, if you travel to certain countries, you have to go into mandatory hotel quarantine. Other countries you can return from and do your 5 days restricted movement and have a PCR test. And there are other countries where there's a further recommendation if you're unvaccinated for a further 5 days. But that's a recommendation rather than a regulation. So it's really about keeping an eye on the gov.ie website. That those are sort of, you know, the government level decisions and recommendations. I imagine they'll change. Obviously, there's going to be the sort of vaccine passport come in. I've queried a couple of times whether the recommendations apply to all ages, because obviously the typical thing will be that you might have parents vaccinated but children obviously not vaccinated. And currently the response I've always had is that it applies across the board. So if you're unvaccinated as a child, for example, then you need to restrict your movements in a way that, you know, the parents might not need to restrict their movements if they've been vaccinated. So, you know, that's a dynamic space. That's very much a government level decision, and gov.ie has the website, which I would recommend for the up-to-date advice for the particular countries that you're going to, or that colleagues or families are returning from.
Actually, we've just got a question in kind of connected to that, and Abby, I don't know if you can answer this, but we obviously have a proportion of our staff who are from Spain and returning home for the summer. So this will affect a number of services. They'll receive their vaccines in Spain before returning to Ireland. Do they need to quarantine before they return to work? It's a very specific question. I don't know if we can answer it.
So, I mean, you have to, you know, it depends a little bit what will happen with the vaccine passport and how that. In general, if you have approved a vaccine, which, you know, if someone's returning from Spain, then it would be in the, you know, if they've been vaccinated in Spain, it almost certainly would be a European Medicine Agency approved vaccine. Then they're counted as vaccinated in the same way as anyone who's been vaccinated in Ireland. And then the travel restrictions that will apply to vaccinated people from Spain will be the same, whether they're sort of Spanish or whether they're Irish who've gone to Spain on holiday. And that might evolve depending on the situation. You know, that's a government level decision. So again, that will, you know, be required to check the website to see what it's saying about people returning to Ireland from Spain who are vaccinated.
Okay, great, thank you. We're getting a number of questions in relation to pods, and I suppose this is also a very current issue. There's changes to pods over the course of the summer, and this could be either for yourself, Abby, or for our TUSLA colleagues. You know, getting questions in around whether, you know, how long play pods need to remain in place, and if they need to remain in place into, let's say, the autumn term, that might pose a difficulty in terms of staffing. Now, I don't think we can deal with the staffing issue at this session. This session is focused specifically on public health measures. But could either yourself, Abby, or Elaine or Eileen maybe talk to the situation around pods and maybe give a little bit more information on that?
I can maybe just sort of start and say something generic, and then colleagues from TUSLA might come in with more sort of useful operational information. I don't see the recommendation for the removal of pods occurring anytime soon. Now, of course, that could happen in a sweep in the morning, but I think it's likely that pods are going to be recommended to be in place certainly for the short while, and as we head into the autumn term. Whilst we get vaccination levels much higher, and I suppose it gives a bit of time to assess what's happening with opening for the country. So I would say that the recommendation will stay in place for the next while anyway.
Yeah.
Yep.
Okay, just I suppose from our side, we would always say to the registered providers, you know, you have to look at your business, you have to look at the children coming in the door, look at what's the most practical for you to run your business, and what's the safest for both your staff and for the children on site. And you may have to review that weekly, given the changing nature of services over the summer period. And again, you'll have to look at it again in September. As Abby said, it's likely the pod system will be in place for some time. So it's important to look at it regularly and speak to your staff regularly, and to keep the pod system as best you can as intact as possible, because that will minimize any problems for you should you have a case. So it's very much going to have to be done locally, and Elaine made the point, what you do well, and you think about it, you know, so and you think about it weekly as the types of the children that come and go to your service. You have to think about their needs in terms of their age groupings, but then you also have to think about the risks with families. So you're balancing a couple of different variables there, and we appreciate it's not easy, and you can only do the best you can do with the staff you have and with your space in your service. So it's important to review it as regularly as you can, particularly with the change of profile of your children over the summer months, and again then in September. So just, you know, think about it and think about what makes sense for your services at a week at a time, and do the best you can. And when we're out with you, we'll be saying the same message, and that our inspectors will be saying the same thing to you, you know. think most people are very used to it now, and we've got into the swing of it, but we have to just keep it at the top of our heads to keep it in check. I don't know, Elaine, if you want to add anything else there from the practical.
No, you're right. As I said, we can't see any change, or there won't be really. And I think, to be fair, it is that individual difference as well between the services in relation to actually activating and maintaining their pods. And there is that change and shift weekly as well in terms of that. So no, I think the pod system will be there for quite a while yet. Yeah.
And we've been asked a couple of specific questions on mixing of pods outdoors, or kind of related to that. What's the situation with staff meeting at lunchtime outdoors to go for a walk, for instance? So I think I'll obviously let you all speak to this, but I think it would be fair to say that the pod system need to be maintained. Systems need to be maintained both indoors and outdoors.
Yeah. You said it, Margot.
And even in relation to staff meeting for a walk at lunchtime, should that be discouraged, and should they just remain within their own pods?
I mean, outdoors is better, but it's, you know, it's that importance of, you know, they still need to be maintaining some distance. Ideally, you would have them, you know, within their pod. If they're it's thinking about your service and how you keep those contacts minimal and minimized, and outdoor is better, but it's not no risk.
Thanks, Abby. In relation to face coverings, so we've got a number of different types of questions giving examples, I suppose, of, you know, somebody's asking quite broadly, should face coverings be worn at all times? Other people are giving examples of, for instance, they're working with vulnerable children, you know, refugees. English isn't their first language, and that face coverings aren't really appropriate when dealing with these children, both because they're traumatized and I suppose because, you know, they're trying to learn the language too. A few other examples there. Can you respond to that in terms of when is the appropriate time to wear a face covering and when isn't?
I suppose from our perspective, you know, it's when it doesn't pose a barrier to care with the children that you're there to care for. So, you know, if people, you know, need to, you know, if they have language difficulties, if they're pre-verbal, if they have learned language difficulties, then obviously, you know, then having a face covering will pose a barrier to the care for the child. And therefore, that's an example when it's, you know, we accept that it's maybe in the better interest of that interaction that the face covering isn't worn, but all the other elements need to be really attained to in terms of the hygiene to make sure that the risks from that are minimized. So it's, you know, that's why it's sort of being carefully phrased, and every scenario is different, and some children with special needs, obviously, you know, that's not appropriate either. So it's about trying to get that balance of where you're needed, where, you know, the interaction requires that you have some interaction, and the face covering is therefore posing a barrier to that care. Then that's an example when, okay, you know, that's sort of facilitated within the recommendations, and it's been sort of phrased that way so people feel able for that. But at other points in time, it's really important that the face coverings are worn. And I suppose from our experience, initially, it was often seen that because there were young children, it wasn't appropriate to have face coverings. Therefore, face coverings never need be worn within the facility, and that was causing lots of problems. And we saw lots of onward transmission and outbreaks from that. So, from our perspective, it's making sure that, okay, if you're not having an interaction with that child, but if you're, you know, up at sort of an adult station with some folders and doing some paperwork, and you're close together with another colleague, that's not, you know, it's not posing a barrier to care to the child to wear your face covering. What it's doing is protecting the onward spread of COVID-19. So, you know, when you're adults talking together at work, like any other adults at work who are close together and not maintaining a distance for whatever very practical reason, that's when the face covering needs to be worn.
And things have improved in that regard too as we've gone on through the pandemic. You know, initially there was a bit of confusion, and then there was different devices. It's very clear now for the last, I suppose, 6 months, Abby, around the face coverings and the importance of face coverings. And I think we're seeing an improvement on site, on the ground as well. People are clearer now, and we're all more used to it as a society in general. So so that's, I think that's a big win over the last number of months, and we've all got used to it, as awkward as they are, you know.
So thanks very much. If there are, I'm conscious it's 3 o'clock, so our hour is up. We've answered some of the questions. There are, if there are some questions you have that you haven't been answered, or you have other questions after the webinar is over that you wish you'd asked, do please feel free to send them in to the EY queries email box, and we'll try to get them answered. I do see a couple of questions just about a couple of people lost connection, and we will be making the video of this, the recording of this webinar, available on the First Five webpage in the next few days, so you can watch it again then, or share the link with colleagues or with parents. So can I express my thanks to Abby Collins, Elaine Murphy, and Eileen O'Leary for joining us for this webinar, and also to Margot and Adele for coordinating it. And can I thank you all for your questions, for joining us to listen in this afternoon, and importantly, can I thank you all for the huge efforts that you've all been putting into adhering to the public health measures in your services over the last year and a half now, and for your stamina in continuing to put all that effort in. Look, I really acknowledge it has been a huge challenge, and the continuation of it is challenging. I'm sure we're all exhausted and we wish it was over, but we still do face these challenges, and we still as Abby and Elaine were saying, the public health measures, they're still in place. It's still the same public health measures that we're being asked to follow. So it's a challenge that you and everybody right across the sector have risen to admirably over the last year and a half. So we just encourage you to keep going. And I think Abby and Elaine have spoken about the success of the public health measures you've taken, what a difference they've made. So we really know that it does make a difference when you follow the procedures, so the public health advice. So do please keep going. So can I also echo the encouragement that Abby gave and Margot on behalf of the department. Do please get vaccinated when invited to do so, and please do encourage and facilitate other staff in your setting also to get vaccinated. So thanks very much, everybody. I hope you found this useful, and hope to see you again in some other forum soon. Thanks. Bye-bye.
Thanks, Toby.
Thank you.
Thanks.
Great.